So this is basically which bone? Mandible bone. And this bone where mainly located? Yes, lower jaw. Okay. So this bone having mainly two parts. Okay. One is the body, another is ramus. Okay. So this is the two ramus are present. Okay. And this is the body of the mandible. Okay. Always remember the body is which shape? This is U shape or horseshoe shape. Okay. And the ramus mainly the two in number. Okay. Right side and left side. Okay. And the anatomical position is like this only. Okay. Always remember the body is always horizontally present and the ramus is vertically present. Okay. So this is the anatomical position mainly. So first discuss regarding your body. Okay. Body of the mandible. Here you can see there are two surface mainly present. Okay. One is external surface, another is internal surface. Okay. External surface having these parts. See, one midline ridge is present here. Okay. This is called symphysis menti. Okay. And below this line here you can see one triangular shape protuberance is present. This is called mental protuberance. Okay. Mental means chin. Okay. So this is the mental protuberance. Okay. Triangular shape projection. And side of this triangle here you can see there are two tubercle is present. Okay. This is called mental tubercle. Okay. And posterior to the mental tubercle here you can see there are two foramen is present. Okay. This is called mental foramen. So symphysis menti, mental protuberance, mental tubercle, and this is mental foramen. Okay. And in the inner surface here you can see one line is present. Okay. See, one line is present here. This is called mylohyoid line. Okay. Mylohyoid line. Upper part of this line here one fossa is present. Okay. This is called sublingual fossa. Okay. Here sublingual salivary gland is attached. Okay. Below of this line there are another fossa is present. This is called submandibular fossa. Okay. Here submandibular salivary gland is attached. So this is called mylohyoid line. Upper part of this line, this is one fossa is present. This is called sublingual fossa, and below submandibular fossa. Here sublingual salivary gland is present. Here submandibular salivary gland is present. Okay. In the inner surface, see there are one tubercle is present here. Okay. This is called genial tubercle. Okay. There are four in number. Okay. Superior to inferior to. Okay. And here you can see in the base means this inferior border. Always remember the body having two border. Okay. Superior border. Here your lowermost teeth is impacted here. Okay. This is the superior border. This is the inferior border. Okay. Inferior border also called the base of the mandible. Okay. Here you can see there are two fossa is present here. See properly there are two fossa is present. This is called digestive fossa. Okay. Here your anterior belly of digestive muscles attached here. Okay. So in the body there are mainly two surface, external surface, inner surface. External surface having symphysis menti, mental protuberance, mental tubercle, and mental foramen. In the inner part, this is called the mylohyoid line. Upper part of this line, this is called sublingual fossa. Here sublingual salivary gland is present, and below this is called submandibular salivary gland here present. Okay. And here you can see one tubercle is present. This is called genial tubercle, superior to inferior to. Okay. And in the there are two border is present. Okay. Superior border, inferior border. Okay. In the inferior border there are two fossa is present. This is called your digestive fossa. Okay. Next, this is the ramus. Okay. Which is vertically present. Okay. So in the ramus you can see this is the quadrilateral in shape, means here four border is present. Okay. This is the anterior border, this is the posterior border, this is the inferior border, this is the superior border. Okay. Always remember the anterior border uppermost part is free. Okay. But lower part is continuation to your body of the mandible. Okay. So this is called your the anterior border. Always the upper part is free. Okay. And the lower part is continuation to your body of the mandible. Okay. And here you can see continuation to the anterior border there are one line is present. Okay. Here this is called oblique line. Okay. This is called oblique line. Here your buccinator muscles is attached this oblique line. Okay. This is the oblique line. And here you can see this is the posterior border. This is the inferior border. Okay, posterior border and inferior border together form one curve. This is called your angle of the mandible. Okay, so how this angle of the mandible is formed? By your posterior border and the inferior border of the ramus of the mandible. Okay, and here you can see this is the superior border. Okay, superior border having two processes. One is coronoid process, another is condylar process, and here one arch is present. This is called mandibular arch or mandibular notch. Okay, this is called mandibular notch, and this is the coronoid process. This is the condylar process. See, condylar process having head and neck. Okay, and here you can see one depression like structure is present. This is called phobia, pterygoid phobia. Okay, pterygoid phobia. Okay, and this is called your external surface and internal surface. In the ramus, always remember the external surface is also called the lateral surface. So this is the lateral surface of the ramus. Okay, and this is the medial surface or inner surface of the ramus. Okay, in the lateral surface there are one important muscles is attached. Masseter muscles is attached here. Okay, or muscles of the mastication. Except this part. Okay, except this part, all together this muscles is attached, because here your which gland is present? This side, parotid gland. Okay, here parotid gland is present. So except this region, in the external surface or the lateral surface, your masseter muscles is attached here. Okay, and here you can see in the inner surface there are another foramen is present here. See, foramen is present. This is called your mandibular foramen. Okay, and upper part of this mandibular foramen, another tubercle is present. This is called lingula. Okay, lingula, and below this foramen, here you can see another groove like structure is present. Okay, this is called your mylohyoid groove. This is the line, mylohyoid line. Okay, and this is the groove, mylohyoid groove. Okay, now okay. So that's all about this mandible bone. Okay, now see the slides one by one. Okay, so the mandible bone is mainly present the lower jaw. Okay, and here your tooth is impacted, mainly the lower jaw tooth is impacted. Okay, this part. Okay, and here you can see another things is present below your, this is called your which teeth? Incisor. Okay, incisor, canine, premolar, molar. Okay, always remember this foramen is present below your premolar teeth. Okay, which foramen? This is mental foramen. Okay, and here you can see this part, this two part. Here two fossa is present. Okay, this is called your incisive fossa below your incisor teeth. Okay, so there are two fossa is present. Okay, this is called your symphysis menti, and side of this symphysis menti there are two foramen or fossa is present. This is called your incisive fossa. Okay, now so this is the largest, strongest and lowest bone of the face and bears the mainly the lower teeth. Okay, this is the lower teeth. Next, the parts. Okay, so there are mainly two parts, three parts means two parts. See, one horizontally oriented body, and there are two ramus, right ramus, left ramus. So this is the anatomical position. Always remember this body is always horizontally present and ramus is vertically present. Okay. Next, see, so this is the ramus and this is the mainly the body. Okay, and always remember this part is called your alveolar process. Okay, where your lower teeth is impacted, means the upper border. Okay, upper border of the body of the mandible. Okay, so this is the alveolar process. Okay, next is the body. You all know the body having two surface, external, inner surface, and two borders, superior border, inferior border. Inferior border also called the base of the mandible. Okay, now the parts. Okay, mainly the external surface, there are symphysis menti present. Okay, ridge like structure here, and here you can see the mental foramen mainly present your below your premolar teeth. Okay, and the oblique line is continuation to your this border. Which border this is? This is the anterior border of the ramus of the mandible. Okay, continuation to and from the your oblique line. Okay, here your buccinator muscles is attached. Next is the incisive fossa. This fossa is called your incisive fossa below your incisor teeth. Okay, next, see, so this is the body. Okay, here you can see this is the symphysis menti. This is the this line is symphysis menti, and here you can see one triangular shape protuberance is present. This is called mental protuberance. Okay, and surrounding this there are two tubercles. This is the mental tubercle, and below your molar premolar teeth, here you can see the mental foramen is present. Okay, and this is the oblique line, and this is the neck. Neck means this part. This is called condylar process. So condylar process having head and neck. Okay. Next is, here you can see this is the mainly this part. Okay, means inner surface of the body of the mandible. Okay, here you can see one line is present. This is called the mylohyoid line. Here mylohyoid muscles is attached. Okay, and upper part of this, here your sublingual fossa is present. Here sublingual salivary gland is present. Okay, and below the submandibular salivary gland is present. Okay, so mylohyoid line, you all know, and mylohyoid group mainly present this part. This is the groove. Okay, posterior to the line. Okay, this is the groove, mylohyoid group, and this is the line, mylohyoid line, and sublingual fossa is upper part, and submandibular fossa is below the mylohyoid line. Okay, next is the ramus of the mandible. This is quadrilateral in shape, means it's having four border. Okay, and two surface, lateral surface, medial surface, anterior border, posterior border, inferior border, superior border. So two surface, four border, and two process. Condylar process, coronoid process. Okay. See, so this is the ramus mainly. Okay, and this is the coronoid process. This is the condylar process having head and neck. Okay, and this is called your mandibular notch. Okay, this is called the mandibular notch. Okay, and this is the angle of the mandible. So how this angle is formed? By your posterior border and inferior border together, this angle of the mandible is formed. Next, in the inside, see, one foramen is present. This is called mandibular foramen. Okay, and here you can see one tubercle is present. Okay, this is called the lingula. Okay, this is called lingula, and below here one groove is present. This is called mylohyoid groove is present. Okay, and this is the digestive fossa. Here your anterior belly of the digestive muscles is attached. Okay. Now the angle of the mandible. So how this angle of the mandible is formed? By your posterior and inferior border. Okay. Now the muscle attachment. See, in the external surface, mainly here you can see the masseter muscles is attached. Okay, except this part. Why? Because here your parotid gland is attached. Okay, and this is called your temporalis muscle. Where this is present, mainly your coronoid process. Okay, here your temporalis muscles is attached, and buccinator is attached mainly your this line. This line is called oblique line. Okay, and this is called your mental foramen. Here mentalis muscles is attached. Okay, now the platysma. Okay, platysma muscles is mainly attached the base of the mandible. Okay, so this is the platysma muscle attached here. Okay, in the base of the mandible. Next, here you can see in the inner part, here two muscles is attached. This is called lateral pterygoid and medial pterygoid. Okay, lateral pterygoid mainly present your this part, this fovea, pterygoid fovea means in the neck of the condylar process of the ramus of the mandible. Here one fovea like structure is present. This is called pterygoid fovea. Here lateral pterygoid muscles is attached. Okay, and here in the angle of the mandible, medial pterygoid muscles is attached. Okay. Next, okay, in the this is called the mylohyoid line. Here your mylohyoid muscles is attached. Okay, and in this is called your digestive fossa. Here anterior belly of the digestive muscles is attached. Okay, see the muscle attachment. Okay, buccinator mainly attach your oblique line, mylohyoid mainly the mylohyoid line. Okay, and there are two muscles is present, genioglossals and geniohyoid. Genioglossals present mainly this superior genial tubercle, and in the inferior genial tubercle your geniohyoid muscles is attached. This is the tubercle, superior genial tubercle, inferior genial tubercle. Okay, and anterior belly of the digestive mainly attached. Here you can see there are two fossa is present. This is called digestive fossa. Okay, next the platysma muscles is attached here in the base of the mandible. Okay, next the masseter muscles is attached here. Okay, and the temporalis muscle mainly this process, coronoid process. Okay, and the lateral pterygoid, medial pterygoid. Lateral pterygoid mainly attached this part. Okay, and the medial pterygoid present in the angle of the mandible mainly. Okay, this part. Buccinator to mainly the yes, chewing, whistling. Okay. Okay, I will tell. Achha, after the class, I will tell. Okay. So there are ligaments. Okay, there are 4 ligaments are present. Okay. So ligaments means attach between your temporal and mandibular bone. Okay. So here you can see there are 4 ligaments are present: stylomandibular, temporomandibular, then sphenomandibular, and pterygomandibular. Okay. Now, if you tell all those things regarding this bone, examiner may ask regarding the difference between the male and female. Okay. So, in the male mandible, size is larger, okay, as compared to your female mandible, okay, and height of the body. So, this is the height of the body. In the height of the body, in case of the male, it is okay high. In case of the female mandible, this is lesser, okay. But in the angle of the mandible, it is everted, and in the female, this is the inverted. And next is the chin. This is the chin in quadrilateral in case of your male, and round in case of the female. And the condyles means condylar process. Condylar process is larger in case of the male, but in case of the female, it is smaller. Okay. Next, here you can see one point by looking this foramen. This foramen is called mental foramen. By looking the mental foramen, you can easily tell this is the children, adult, or old age mandible. Okay. Always remember, in case of the children, this is mainly present in the lower part. Okay, in the lower part, because this part is not developed properly. Okay, that's why. And in the adult, this is present midline between your upper and inferior border, means superior and inferior border. Okay, but in case of the old age, this is upper. Okay. See the reason. So at the infant and children, the body of the mandible is mainly made up of the alveolar part containing both the deciduous teeth and permanent teeth. Okay. And in case of the adult, this is moves downward, means it is present mainly in between your superior and inferior. Okay. And in the old age, it lies mainly in the old age. This part is destruction. Okay. So that's why this is lower. Okay. Oh, sorry, upper. Okay, because it close to the alveolar border. Okay, due to the resorption of the alveolar process, this is get upper position. Okay, so in case of the infant, it is lower, but in case of the adult, this is midline, and in case of the old age, it is upper. Okay. Another is these things, the angle of the mandible. In case of the children and adult, children and old age, this is 140 degree. Okay, but in case of the adult, this is 110. Okay, here another thing is present. This is called your coronoid process. This is the condylar process. In case of the children and old age, this is upper. Okay, but in case of the adult, this condylar process is upper. Okay, see relationship between the condylar and coronoid process. Okay, so coronoid process the above the level of the condylar process. Okay, but in case of the adult, the condylar process is above. So this is the condylar process above, but in case of the children and old age, this coronoid process is above here. Okay. Next, the fracture of the mandible. Always remember, these 3 sides commonly get fracture. One is, this is called your neck of the mandible. Okay, neck of the condylar process of the ramus of the mandible. Another is the angle of the mandible, because this is the curved structure. Another is here, which teeth is impacted here? This canine teeth. Okay. So these 3 reasons easily get fractured by any kind of trauma or fall from height. Okay. So at the angle of the mandible, okay. Another is the neck of the mandible, and another is the canine region here. Okay. So these 3 sides get easily fractured. Okay. So that's all about this today's class.